Hello, everyone. Thank you for joining us today for the first webinar this year in our peer-to-peer webinar series. My name is Claire Howard, and I'm a research coordinator at the National Collaborating Center for Methods and Tools, and I will be your moderator for the webinar today. And today's webinar features a presentation on the City of Hamilton's rabies awareness work. So we just have a few items to cover before the presentation begins. So please use the chat box to post comments and any questions during the webinar. And if you can't see the chat box in the panel on the right-hand side, you can open it by clicking on the speech bubble that should appear if you hover your mouse over the slides. We also recommend using a wired connection. And if you are having connection issues, the WebEx helpline is on that slide, and it should also be in the chat box. You can also, if you're having an issue hearing any audio or connecting at all, you can post that in the chat box as well, and we'll make sure to get back to you. So our slides today will be available after the webinar in English and French, and we will also be posting a recording of the webinar in English only, and you'll be able to access them at that link that's on the slide and should also be in the chat box. So we have a few poll questions today as well. So the first poll question here is, how many people are watching today's session with you? Is it just you? 2 to 3 people, 4 to 5, 6 to 10, or more than 10? I'll give you a few minutes to answer that question. Okay, everyone, thank you for your responses, and we'll move on to our next poll question here. Have you ever visited the NCCMT website or used our resources? Okay, thank you everybody for your responses again. And our last poll question of this first part here, if you said that you did visit the NCCMT or have used our resources, how many times have you used our resources? So once, 2 to 3 times, 4 to 10 times, or 10 or more times? Okay, so thank you everyone for answering those poll questions for us. As I said earlier, this is the first webinar in our peer-to-peer webinar series where we share evidence-informed decision-making success stories from public health professionals across Canada, and we are very excited for everyone to be joining us today. So if you're not familiar with us, there are 6 national collaborating centers, and the NCCMT is one of 6 national collaborating centers. We're hosted by McMaster University in Hamilton, Ontario, and our goal is to support public health professionals and organizations to integrate evidence-informed decision-making into their work and practice. So the National Collaborating Centers are funded by the Public Health Agency of Canada, and we each focus on a different priority public health topic. So from the West Coast, we have the National Collaborating Center for Indigenous Health in Prince George, British Columbia. We have the National Collaborating Center for Environmental Health in Vancouver, British Columbia. The National Collaborating Center for Infectious Disease in Winnipeg, Manitoba. The National Collaborating Center for Healthy Public Policy in Montreal, Quebec. And the National Collaborating Center for Determinants of Health in Antigonish, Nova Scotia. So at the NCCMT, we have many products and services available online to support public health professionals in engaging in evidence-informed decision-making. So we have the Registry of Methods and Tools, which has over 270 methods and tools online for evidence-informed decision-making. We also have online learning opportunities, including our 13 online learning modules. We offer workshops. We have Public Health Plus, which is a repository of public health research. We also offer video series, which include our Understanding Research Evidence videos, which explain research concepts in very short and easy to understand ways. And we are also always out networking and outreach. So if you ever see us at a conference or any other networking opportunity, please come and say hi. And also, as I had mentioned before, this webinar is based on, or this webinar series is based on our evidence-informed decision-making casebook. So we are now in our 3rd issue of the casebook, and it's a collection of stories from public health and evidence-informed decision-making. And if you haven't looked at it, I really encourage everyone to go take a look at it. They're really great stories that highlight how evidence-informed decision-making can be used in public health. So our presenter today is Jane Murrell. She is a supervisor for health hazards and vector-borne diseases program with the City of Hamilton. And I will now pass it over to Jane to talk about her work.
Good afternoon, everyone. So today I'm going to talk about our Rabies is Real campaign, where we use evidence-based results to widen our rabies awareness in the community. So just a little bit of background information. In 2015, everything changed for us. December 4th, we received a positive report that we had Raccoon rabies strain in Hamilton. This was the first report of Raccoon rabies ever in Southern Ontario. And as you can see here, our culprits were these 2 dogs that were picked up at large in an animal services vehicle. As well, there was a raccoon that was ill in the vehicle. Everyone was in their own cages, but one of the dogs, Lexi, managed to get out of her cage and then bite through the cage where the raccoon was and suffered some wounds. That is the actual cage that the raccoon was in. So we learned later on in our outbreak that it was from a translocated raccoon, probably close to the Vermont area, 500 kilometers away. Not that particular raccoon on the garbage truck, but definitely one that hitched a ride. As of today, total is 326 cases for Hamilton alone, 469 in all of Ontario, with 21 fox strain. This is the breakdown by species: 214 raccoons, 110 for skunks, 1 fox, and 2 stray cats. This is a map that's produced by the Ministry of Natural Resources and Forestry. We receive these updated maps every time there's a new positive case. The red diamonds up to the left is the fox strain. The purplish blue circles are the raccoon strain, and all the green dots are negative samples. So we learned quite quickly that our old rabies resources probably weren't going to do the trick. We now had an outbreak in our community, and our resources, although good, were not going to grab the attention that we needed to bring rabies back into the minds of residents and make sure that there was proper education going on. So what we needed was a new campaign, and the goals of that campaign was to grab attention, prevent exposures before they happen, and drive people to our website for more information. So we contacted a third-party company to create some examples of a campaign for us, and this was the initial results they provided us. The Raccoon campaign on the left, and then a generic campaign on the right. The one with the raccoon alone, very typical of many agencies and industries out there. something you see all over with rabies resources. The Raccoon, on the other hand, definitely caught our attention, and we were really intrigued to hopefully go with this campaign. But we needed to do some focus group testing first to see what the community thought. So we took the two campaign ideas out into the community, asking different participants, including internal staff, members of the public, pet owners, children, and even some non-English speaking residents. We went to various locations like dog parks, international centers, other city departments, and even a children's day camp. We wanted to keep the focus group testing simple, and all we did was show the poster to the participants, both posters, and ask them to select which one they liked most and tell us why. After that, we also asked them which poster would most likely get your attention and create conversation. And a resounding 84% chose the Raccoon, and some of their comments were, it's different and eye-catching, it might trigger questions because it's weird, and it's more likely to be shared on social media. 5 individuals, though, who chose the other poster, the Raccoon alone, changed their minds when asked the question, which poster would most likely get your attention and therefore create conversation? So that was really interesting to us because that was one of the goals of that campaign, was to grab attention, and if their answer changed with the Raccoon, that added to our strength of choosing that campaign. An interesting point, though, most non-English speaking residents also selected the Raccoon poster. They thought that the Raccoon in the other poster was a dog because there are no raccoons in the country they come from. While the hybrid image using the bat caused them to question that poster and what was it about. They could recognize a bat, but not a bat with that face. So they definitely wanted to know more about what information was on that poster. So the finished product looked like this, our Raccoon, and then its counterpart, the Skox, which is the combination of the skunk and the fox. Not a whole lot different from that original version, but definitely more of our colors, crisper looking, and can definitely stand out. We then put that campaign up at various areas around our community, transit stations, even in the Lime Ridge Mall during Christmas, and it just happened that the location we selected was right near Santa's workshop, so we definitely got a lot of exposure there. We also did arenas in Hamilton and billboards. We also wrapped one of our animal services vehicle, knowing that this vehicle will be on the road every day and on the road for multiple years. It was a good use of our money to get our messaging out on a continued basis. So sharing is caring. We also shared our campaign with other health units and key partners. So to date, 3 other health units have adopted the campaign for their own rabies education programs, and also the Ontario Association of Veterinary Technicians used the images for their Protect Your Pet campaign, both in 2017 and 2018. And just recently, the Department of Health in Maryland contacted us, and they are now using the images for our rabies campaign that they started in 2018. So we're glad that the Raccoon and Skox are international now. So now we wanted to measure the success and outreach of that campaign. So we wanted to do some evaluations out in the community. We did a sampling evaluation in 2018 using both online and hard copy surveys. And the objectives of that evaluation were to determine the reach of that awareness campaign and also determine the level of knowledge of rabies for residents in the city of Hamilton. So here's some of those results. Approximately 2,400 entries were received, 95% of them living in Hamilton, with 93.8% hearing about rabies prior to the survey. 85% indicated they were aware of the rabies situation in the city, and these are the various outlets that they received that information: news, TV, Facebook, their vet office, and doctor's office, and radio. We also asked about our Raccoon and Scox ads specifically, and almost 53% indicated they had heard of them. And when asked where they saw them, billboards was the most indicated response. Some more of the results from that evaluation. So the rabies can cause death. We got 82.5% on the yes for that. We also asked them to identify animals that rabies could be found in. You see I highlighted cats in red because we were a little concerned that cats were lower on the scale from dogs and wildlife. When asked what to do if scratched or bitten by an animal, a little bit lower response on the washing wound with soap and water, and then how to protect your pets. Those answers are available there as well. So results of that evaluation revealed that more efforts were needed to focus on cats being a potential vector species. And given that Hamilton has already had 2 rabid cats since the outbreak started, this became a new program objective for us. And with that, the PurPup was born. So that's a hybrid of a cat and dog, obviously, and this new image was focusing on domestic animals being at risk for rabies, and was also more appropriate for rabies education in veterinary clinics, where the public could actually relate that messaging to the pets they owned. But in the middle of our evaluation and our campaign going full force, we started to also see an uptake in cases of exposures around post-secondary education facilities, as well as Facebook pages being made for wildlife around these institutions. So we kind of dropped everything in the middle there and decided we needed some education on not risking your life for a selfie. So we had these billboards created. We also have a Fox version. And we posted those around the city where we had a lot of higher risk exposures to residents actually handling wildlife. So some of the lessons that we learned, sharing the campaign definitely broadened the impact and the reach of it. So like I said, we managed to reach all the way to Maryland. So it was a good idea of us to make sure that that campaign was able to be used by anybody that needed to add that to their rabies resources. We also learned that the word Scox has its own urban dictionary meaning, which is not very respectful of our campaign. But we also realized that anytime we use the Scox image, it is paired with the text, so we weren't too concerned about that in the long run. And the evaluation also showed some residents were unaware that rabies is fatal and proper wound care should be essential during that first step. An unplanned but fortunate outcome was the image of the raccoon. Like I stated earlier, it transcended language barriers, as many non-English speaking residents recognized that but wanted to ask more questions when the image was combined with the raccoon. This was definitely not something we considered prior to the design stage. The Rabies is Real campaign has also been very popular on social media platforms because of its unique and eye-catching images. So when searching the raccoon, these are just some of the images that come up. So any questions?
Just to remind everybody, if you have any questions, please send them through the chat box to all attendees, and we'll be able to see them come through. Okay, so just while we wait for questions to come in, I have a few. So I noticed that you mentioned several different sources of evidence, which is really great, from surveillance data to focus groups and surveys. At the NCCMT, we do focus a lot on research evidence, so I just wanted to ask you about whether you looked at research or if there's this type of evidence in the research literature, or
So no, we didn't do a big research study prior to this. We were kind of under time constraints and knowing that we had an outbreak in the community and our past resources were out of date and not eye-catching at all to get this message out. So we were kind of under a tight timeline, but we did want to make sure we brought it to the community and get their opinion on it, because that's who we were trying to, reach.
Mm-hmm. That's great, thank you. So I have another few questions here. So you also mentioned specific outreach to university students. Has there been any outreach to healthcare professionals or other people who might see somebody who's been in contact with rabies? Or?
Oh yeah, definitely. We have done presentations with our healthcare providers, as well as yearly medical releases on the topic of rabies and what the situation is in Hamilton. So we definitely keep them up to date on the situation.
That's great. So we have a question here. You had a lot of respondents to your post-campaign survey. Did you expect this number of respondents? And did you have any ideas about why you had so much success in getting the respondents that you did?
So I think the success of the evaluation was two-part. One, we did offer free year-long membership to our rec centers in Hamilton, either individual pass or family, whoever had one, and we gave out 10 of those. So that definitely brought some attention to filling up this survey. But I think also doing site visits, we went around to rec centers, libraries, municipal service centers, to actually see and talk to the public while they're at these locations, because not everybody has access to a computer, and some people are more comfortable with filling out a form right in front of you. So I think both those methods together helped to create that success of the amount of feedback we got.
That's great. So we have another question here from Damian. Is there a reason why raccoon rabies is prevalent in your community?
So it is prevalent now because of that translocated raccoon back, we found out about the strain in December 2015, but the estimate is that it was probably circulating for close to a year, if not more, before we located that first animal with it. So raccoons are extremely well at hitchhiking rides. It probably got on a truck, a transport truck of some sort, or even a train, and ended up entering into Hamilton. And it does happen quite often that drivers will open up the back of their truck and they see the raccoon, and so they just leave the doors open and then the animal runs off. So that initial patient X, so to speak, the raccoon, would have then started infecting our wildlife into the point where we then found out we have the strain, and it was already at the outbreak level because we were getting positives really rapid at that point.
Okay, great. So I have one last question. Do you have any plans for another evaluation or looking at this anymore to see if the better awareness and the more preventive measures do result in changes like more pets being vaccinated and things, or have you already seen that?
We've definitely seen that, and it could be multiple things that are affecting that. We do host 2 low-cost clinics in Hamilton for residents. Definitely our enforcement is on the radar now, but we also have different ways that residents can access rabies vaccine when they're unable financially to take their pet for a rabies vaccine. So it all works like a big circle, right? You need to give them the education and the awareness, and then you also need to help provide that for them, that in the example of a vaccination, when there's financial hardships as well. So we have multiple low-cost options in the city of Hamilton, which we're really proud of now, and that's thanks to our local vet community.
That's great. So we have another question coming in from Richard here. Do you have any campaigns specifically targeting the public and trying to reduce the number of animal bites?
Besides this campaign, no, which this campaign does kind of, if we go back to that original screen here, our messaging on there is kind of small, but it is, protect your family and pets, stay away from raccoons, skunks, foxes, and bats. And then there's a little more detail about reporting if they see sick and strange behaving wildlife, and then also reminding them to vaccinate their pets.
Okay, and we have a question from Andre. Do you know what media was the most successful in grabbing people's attention? So car wrap, poster at the arena, or poster at the bus station, or anything else you did. So in other words, what media would you focus on using for a new campaign?
So the billboards were the #1 selection in the evaluation. But anecdotally, I can say that the vehicle wrap was our biggest bang for our buck, and the fact that the billboards are only up for a short period of time at a high cost, whereas the vehicle wrap is on the road every single day. And the mall banner was really successful. We did get a lot of calls on that children had seen it and told their parents, you need to call because I saw the Raccoon, but that again was only for a short period of time. So longevity-wise, I think you need images that are going to work well on social media, and then also that longevity of the wrap on the vehicle, that it's in the community constantly.
Okay, great. So I don't see any more questions coming in, but if you do have a question, I think Jane will stick around for a little bit longer.
For sure.
So if you have anything that comes to mind, please feel free to send it to that chat box. So I am just going to go through a few last slides that we have today. And I just wanted to say thank you to Jane again for coming in and presenting for us. It was a very interesting story, especially myself being a Hamilton resident. I've seen these posters and everywhere on the bus shelters and stuff, so it was really neat to hear kind of what went on behind the scenes with that as well. So if any of you have a story that you would like to share with us, we would love to hear it. So our email address is up there. It's nccmt@mcmaster.ca. And if any of you also need support or would like to know more about evidence-informed decision-making, you can also contact us for help, again, at that same email address. And we usually respond within 24 business hours. And we have a few last polling questions here for you today. If you could answer, it helps us evaluate our webinar series, which is really helpful for us. So the first question is, participating in this webinar increased my knowledge and understanding of the application of EIDM or evidence-informed decision-making. I will use the tool or method, so the casebook from today's webinar in my own practice. Which of the following statements apply to your experience with the webinar today? It was relevant to you in your public health practice. It was effectively facilitated. There were opportunities to participate. It was easy to follow, and it met your expectations. And if we can contact you in the future as we continue to evaluate our webinar series, that would be very much appreciated, and there's an option for you to enter your information there. So I'll just give everyone a few minutes to answer those questions. Okay, thank you everyone for answering our questions. That really helps us with our evaluations, and we appreciate all of your information. I am just seeing another question come into the chat box, so we'll get to that. From Gordon, I presume that you have not had any human cases in Hamilton. Did you find that the unfortunate fatality on Vancouver Island had any effect on rabies awareness in Hamilton and, by extension, Ontario in general?
It's a very good question. No, we've not had a human case, and that is because all our reported cases are followed up with and vaccine provided if necessary. Unfortunately for the BC case, that individual never did report his bite, and yes, it definitely impacted not only Hamilton, but many health units, to the point where there was actually a shortage of rig that we had to then be aware of throughout Ontario and make sure we were doing really good risk assessments, because it seemed that the public thought just seeing a bat meant that they were exposed and wanted vaccines. So we definitely had to amp up some education and doing some risk assessments with the community after that case. The timing of it also wasn't great in the fact that August is our busiest time for bat exposures, and that case really ramped up in the media in July and therefore affected August greatly.
Great, thank you. And just a reminder to everybody, if you have any questions too, we would be happy to connect you with Jane. So I'll just put our email address back up for a second there. If you have any questions or if you would like to access the materials, as Jane said that they've shared it with other organizations, please feel free to email us at nccmt@mcmaster.ca, and we can definitely put you in contact with Jane for that information. So our next webinar will be happening on Thursday, December 12th from 2 to 4:30 p.m. Eastern Standard Time. And this webinar will be about iGeriCare, which is an online platform for caregivers of people living with dementia. So if that is of interest to you, please join us. We would love to have you join that webinar as well. We have a number of webinar series from NCCMT. So we have a spotlight on methods and tools, topic-specific methods and tools, the online journal club, and this webinar series, the peer-to-peer webinars. And we announce all upcoming webinars in our monthly newsletter. So I suggest signing up for that newsletter if you haven't, and keeping an eye out for the webinars in this series. So thank you again for everybody joining us today. It was a really great webinar, and thank you again to Jane for presenting to all of us on this information. So with that, we'll end the webinar today. I hope everyone has a great rest of the day.